the Reviving Hope Project. My name is Jessica Cantrell.
I'm Isabella Luciana.
I'm Paul Serrano. And I'm Sophia Almodovar.
We have chosen candidate A, which is Liv Hart. Her age is 41 years old. Her application is that she is a Disney worker manager. She lives in Orlando, Florida, and her salary every year is from $33K to $55K. Liv is a Disney manager and has been working there her whole life ever since she got out of college. She is 14 months sober from the last time she has ever drinking a drink and is ready for this heart surgery. She wants to be able to watch her daughter grow up, and that's the reason why we chose her for the surgery.
There were three main reasons why she was chosen. The first reason being the principles of the hospital. The second reason being the health insurance that Liv Hart has. And the third reason being the probability of organ rejection in Liv's Hart's body.
As stated previously, one of the main reasons we chose candidate A, Liv Hart, to be the organ recipient is because of her morals. According to the Department of Medicine by Sweats, quality of life can be accurately measured and used. In this case, Liv Hart was an excellent candidate due to the fact that she is 14 months sober and you only need to be 6 months sober to be eligible for the heart transplant, and she has her 6-year-old child giving her motivation and positive reinforcement throughout this entire journey, as well as she has her mom that is pushing her to make sure she stays sober and really takes care and appreciates the new heart that she is getting. Here we have a photo of what a normal heart looks like compared to the heart of an alcoholic. The left ventricle and the right ventricle are swollen, causing the heart muscle to stretch, which puts a lot of strain on the heart, so it's not able to pump all the blood properly through the body. And you can see why she really needs this new heart. Lastly is rule of rescue. According to Sweats and the Medicine Advancement Heart Failure, the rule of rescue is noted when an obligation to save a life outweighs competing values. In this scenario, it is important to take into consideration the fact that she has a 6-year-old child that would be left an orphan if she doesn't make it through this, because she is a widow, meaning the child has no dad and right now is under the care of the mom, or the grandma. And the grandma is at a certain age that she won't be able to live so long to take care of the child the rest of their life. So we need to make sure the mom pushes through and really makes it and is able to take care of the rest of her child's life.
So, heart insurance. So, what is health insurance? Health insurance is a plan that people pay for to cover any medical costs. If somebody gets sick or hurt, health insurance is there to pay for their hospital visits, their medicine, and anything medical. It's there so that they don't have to cover the full cost of like a surgery or whatever. Liv Hart, our candidate, she has employee-sponsored health insurance, which is provided by the company. And in the graph here, it shows the amount of investment that goes into healthcare, and this is a good consideration for the employees who benefit off the health insurance like Liv Hart. And when she is done with the surgery or recovery, she'll go straight back to work, which means that if the health insurance doesn't pay enough for doesn't pay the cost of the surgery, the full cost of the surgery, then she can do out-of-pocket payments, which is depending on her monthly income, and that will cover most of the cost of the surgery. And we didn't choose the other candidates because one of them doesn't even have a job or health insurance, and the two work 80 to 60 hours a week, which means that they won't be able to cover the full cost of the surgery without working, and they don't even have health insurance either, which it doesn't even help them with that either. And
one of the main reasons why Liv Hart was chosen as our candidate for the heart transplant is because she has the biggest reliability of not only making it through the surgery, but not getting organ rejection. Even though she was an alcoholic, she has been 14 months sober for a very long time, which means she meets the requirements for the surgery. Well, you might be thinking, what process does she have to go through to be able to meet these requirements? Number one, she has to be willing and have moral support to be able to get through the surgery. She is currently on a VAD with a vascular assistant device which helps her keep her blood free for all lower chambers of her heart. To get through the rest of this process, she also has to be able to deal with the surgery. Is she going to be able to wake up, or is she not going to be able to? To be able to do the surgery, it's not only difficult for the doctors, it's also almost as more difficult for the patients. When the patient will go under for surgery, a small incision will be made through the rib cage and going through all the way down to the deceased heart. The deceased heart will be then taken out and put in the new donor heart. She meets the requirements because she is a very strong person and has been ready for the surgery for almost 14 months now.
Organ rejection is when your body doesn't accept the heart. It doesn't see it as one of its own, and it struggles, and your immune system doesn't identify and immediately tries to attack it since it sees it as a foreign object. The symptoms of the rejection can vary from a fever, from swelling, and even discoloration in the transplanted area. The precautions taken to prevent organ rejection is there's medicine called immunosuppressant. Immunosuppressant suppresses your immune system and tells your immune system to stop, that the organ is there to help you, and it's important for it. For example, here in the graph, it's freedom from rejection versus days after transplantation. The higher the graph line, the better the chances of survival. For example, right here, the immunosuppressant Basimax has a higher chance of survival, while without an immunosuppressant has a lower chance of survival after the transplantation.